Sometimes you get a notch in your nose because somebody took a cancer off you, but they didn't reconstruct it. So what do? We have to go to the operating room and import the defect by making the defect over again. The step-by-step instruction sheet goes like this. We have to take a template from the defect that's notched. We have to fill in the space by borrowing God's perfection from the ear. And then we re-rotate the ear after we take a piece of cartilage that's lined on both sides with skin lining. Reach up and grab your ear right now, you know what I'm talking about. Once we import that area, we suture it in with some deep sutures to line with the cartilage to make sure the nasal sill isn't blocked. You want to be able to breathe through that nose, so the defect has an area that gets inserted right here, which you'll see on the video. Once it's inserted, it has to take as a graft because it doesn't have its own blood supply. But once it lives, you have three-dimensional lining inside and out that looks beautiful, so the person can go back into society having a notched nose, and they have a close-up view that says they look before and after much more acceptable. The notched nose doesn't have a big tell until you look at it closely, but once you realize that that ear patch that goes in there perfectly makes the person have much more confidence from having a notch in their nose to having a very beautiful restoration of their nose feature, and with no consequence for their ear because the ear is camouflaged.